Hey, what's going on, everyone? This is Drew back here at VCS 2017. I'm joined by Dr. Okoro, who's become a good friend of mine. I got to talk to him just last month. How are you doing?
I'm doing well, Drew. How are you doing today?
I'm doing great. It's really good to see you. You look great, as always.
Thank you very much. Try to represent.
Yeah, so I saw you last at ASAPS. We're at VCS right now, which is a multi-specialty show, so there's a lot of different specialties here.
That's
Talk
right.
to me about your experience here so far.
So VCS, as you know, is a multi-specialty. Probably one of the only multi-specialty meeting.
I think it is.
It is, and it's very good. It brings together dermatology, plastic surgery, and facial plastics, the best of the best. So that's what makes it different when compared to the other meetings, basically.
Sure. So at this show, are you getting to kind of, I know the presentations are kind of broken down between some are plastic, some are kind of body contouring, some are like dermatology. Are you able to collaborate with some colleagues in different industries or different medical specialties?
You know, it's all about collaboration. It's called the collab now, right?
Yeah.
So it's very interesting learning how each specialty do things, and so you pick up a little piece of this and that.
Right.
It makes you a much better physician to kind of help your patients, so delivering the best of the best to your clientele.
Right.
So
for sure. Cool. Good stuff. So I've been hearing there's a lot of international speakers here as well too.
Right.
So how is that getting to talk with the international? Because they do things a little differently too, right?
It is. I mean, coming to this meeting is not just the way we do things here in America. You learn about Europe, Africa, South America, Asia. So it really is help. So I think it makes you a complete physician. For me as a plastic surgeon, I basically feel like I'm bringing the world to my patient.
Right.
You know, like you don't need to go anywhere else. I got it.
Yeah.
You know,
and we kind of talked about that at ASAPS too a little bit
so
too.
it's like, this is it.
Yeah.
It doesn't get any better than that.
Yeah.
So
cool.
That's pretty much. This meeting is really, for me, what I'm going to take home is like hair restoration for my patients, kind of putting it all together, the surgical, the non-surgical, things like PRP, laser.
Can you help me?
I think you're beyond help. Just keep wearing the hat.
I've been told that before.
You are good. You're good. But
I'll keep the hat on.
Yeah, keep the hat on. But Drew, you don't need it. You look great.
No, I know. That's why I grew the beard out.
Yeah.
So I can't get it up here. I'm coming down here.
Hey, it looks great, man. Just
Thank you.
Keep it up. But now we're able to combine the surgical and non-surgical to give the patient the best of the best. Because they deserve the best.
So were there any sessions here that you've attended that were talking about hair restoration?
Yeah, so, I listened to Dr. Lamb's, his talk. Sam is a very smart guy about hair restoration. He does a lot of it. So I listened to him. I learned some of his technique and combined with my own technique. And pretty much I wanted to make sure that my patients are getting the best of the best.
So talk a little more, if we're talking to your patients right now, talk a little bit more about your technique. What can they expect?
So when I come back to Atlanta, you're going to expect more medical, cutting edge medical therapy. Things like using PLP, modulating it with light. And then before we even talk about surgery, surgery is just a piece of that.
Okay.
So you can get a much better hair growth and much better result. So
gotcha.
That's what we're going to talk about.
Now, what kind of for results, like what should the average patient expect for results as far as like a time frame goes?
It takes about a whole year.
Okay.
Really. From the time you start the process.
And it's multiple.
It's not one thing. It's not just hair transplant anymore.
Yeah.
I mean,
you do it, you're done.
I call it smart hair restoration.
Okay.
Smart because you get a smart doctor, smart grafts, smart medicine.
Okay.
This is smart hair restoration.
Right,
That's
right.
what we're talking about now.
Okay,
so
cool.
It's beyond hair transplants.
Right. Awesome.
Yes.
Beautiful. Well, good stuff. Is there anything else you want to talk
No,
about?
It's good seeing you, man.
It's good to see you.
Put up a smile. I'm glad you guys are doing very well. It's good to see you guys.
Thank you. It's
again.
always a pleasure to see you.
Well,
thank you for joining us again.
Thank you for letting me come by.
Yeah, you got it. Anytime. All right, take care.
All right, bye-bye.
Ooh.